Okay, so you just had your rhinoplasty, you're in the recovery room, and you're about to head home. Here's what you should expect that week. There are some basic recommendations that we tell everyone. We tell people that they should avoid heavy lifting, they should avoid strenuous activities, mostly rest that week. You should do a lot of icing that week, especially days 2, 3, and 4, as well as take your medications. Those medications start on day 1, not the day that you have the surgery, because you had medications from the surgery. So you're going home, you might feel a little groggy, you might not sleep well that night, that's okay. It's unusual to have a lot of pain. We give numbing injections that numb you for 3 days. Most people don't do that, but we do. And you should have very little pain. We do give you some pain medication in case there's any breakthrough. Some patients will actually just use the pain medication to help them sleep the first night. But if you have a relatively sleepless night, that's not unusual. The next day, you're going to start your pain medication. You're going to start icing while awake. Obviously, don't wake yourself up in order to ice. Ice as much as you can. Bruising and swelling is going to be at its worst on days 2 and 3. So on day 1, if you look fabulous and then you're like, oh, I don't need to ice, well, you're in for a little surprise on days 2 and 3. Icing is also very good for comfort, so it can help relieve any discomfort or pain. You're starting your medications, you're doing your icing, you're keeping your activity levels low. You can eat whatever you want. We don't want you throwing up or getting nauseous. So if you tend to get a little unsettled for something that's spicier or more flavorful, then keep it bland. If that doesn't happen to you, eat whatever you want. You're allowed to chew. It may be hard for you to eat just because your nose may be very congested from swelling and crusts. So that may be the only limitations on obviously needing to breathe. But you can eat what you want as long as you can do it comfortably. We're doing the icing, we're keeping our activities limited, and basically we're doing nothing else. We're not lifting anything heavy. We're watching a lot of movies on Netflix. You should get a list of things that you want to watch during your recovery vacation, and that'll keep you busy. Now, if you have any questions, you can give us a call. You will generally get a photograph of your new profile if you had profile work done the night after or the next day from the surgery. So you can look at that, put that on your little mood board, keep you motivated during the week. By the time you get back to the office on day 6 or 7 for your cast removal, you will start to have less swelling and less bruising typically. It won't be 100% gone. During that week, you are not allowed to blow your nose or pick out crusts. We don't want you bleeding. And if you blow your nose, some of the incisions inside your nose may not be totally healed, and you may actually wind up blowing air into the soft tissues of your face. I can guarantee that's not a pleasant thing to experience, so don't blow your nose. When you come back to the office, we will clean you out in a controlled fashion, as much of the crust as we can do. We don't want to make you bleed ourselves, so sometimes we have to leave a little bit of the crusting, but most people feel very, very, very comfortable at that appointment when they get the cast off, and they finally get to see at least the initial result, which will be a little swollen and a little bit strange looking just because of the nature of the surgery and the casting and the fact that it's only 6 or 7 days. You will be able to see the beginning of the journey that we decided to go upon together when we planned your surgery.